He is a local cancer doctor that scores of women have turned to during health challenges. But tonight, the 7 investigators are revealing claims that he crossed a line by performing surgeries that were not needed.
Tonight, 7 investigator Ross Jones talks to his former patients and a former colleague who tried to stop him.
Just having another doctor do that to you makes you question everyone's motive.
Jamie Sherman came to Dr. Vinay Malviya to feel better. But the man she and scores of women have trusted over the years left her broken, she says, a fraction of the woman she used to be. For decades, Malviya practiced at hospitals in Southfield, Detroit, Warren, and Rochester. He has been accused by his former colleagues, other physicians, and the Department of Justice of performing aggressive surgeries that patients did not need. Jamie says she's one of them.
It breaks your trust. It makes you not want to go to the doctor because you're afraid that they might have some ulterior motive of making money off of a surgery from you.
Jamie came to Dr. Malviya in 2017 after experiencing stomach pains and weight gain. She was concerned by a history of ovarian cancer in the family, but genetic testing showed the cancer could not be passed on to her. And after visiting Dr. Malviya at Ascension Hospital, she learned she had a cyst on one of her ovaries.
I kind of went in with something that wasn't, to me, a big deal, and it turned into a big deal very quickly.
She was surprised to learn that Malviya ordered a total hysterectomy, removing her uterus, cervix, and both ovaries.
It did seem kind of bizarre that I had to have a full hysterectomy at my age.
35.
35.
In Jamie's case, she didn't even have cancer at all. But rather than explain to her what options she might have, he preyed on her fear of the word cancer.
Donna McKenzie is Jamie's attorney and is preparing a lawsuit against Malviya on behalf of Jamie and other patients. Years after the surgery, Jamie says the side effects are still with her. She has repeatedly had to be hospitalized over intense pain and today struggles with depression.
She wanted to do whatever treatment the doctor said was necessary. And again, he didn't give her any other option. It was surgery and it was now.
What Jamie didn't know during her surgery was that in the year prior, even Ascension Hospital had concerns about whether Malviya was performing unnecessary surgeries. They ordered another physician to review his work in 2016, who found repeatedly that Malviya performed radical hysterectomies when only simple hysterectomies, a much less risky and invasive procedure, were warranted. Another physician later hired by state watchdogs reviewed Malviya's treatment record, finding that in 12 cases where he performed a radical hysterectomy, the procedure was not appropriate in 9.
His patients would leave with big incisions. It was very common for those incisions to get infected.
One physician said that Malviya often overprescribed chemotherapy and said that by overtreating patients, he repeatedly caused actual harm, from excessive blood loss to bone marrow suppression to kidney damage, while raising the risk of long-term side effects like bladder dysfunction.
It was a common practice for him to go in, and they called him the butcher.
In 2017, Malviya's own colleagues went to the FBI. We spoke with one of them, who now lives out of state. Because she still works in the field of healthcare, she asked that we not name her or show her face.
Many women were harmed where there's no coming back. And we said we cannot stand by and allow this to happen anymore.
Prosecutors allege that Ascension grew concerned by complaints from Malviya's patients and suspected higher than average rates of pulmonary embolisms and surgical infections. The Department of Justice filed suit against the hospital, who in 2021 agreed to pay $2.8 million to resolve claims that they overbilled for unnecessary Malviya procedures. Ascension says they eventually ended Malviya's contract, though would not say how much longer he practiced there after warning signs emerged. But elsewhere, Malviya continued to perform surgeries.
I think the incentive is economic, making money off unnecessary procedures or very aggressive procedures beyond what the patient needs.
And there were more troubling findings about how Malviya treated patients. For a woman with stage 1 endometrial cancer, a physician hired by the state found that Malviya removed a substantial portion of her upper vagina. This is egregious surgical management, the physician wrote, suggesting that Malviya's decisions were influenced by a lack of knowledge as well as financial gain. He added, "The fact that Dr. Malviya performed a radical hysterectomy for this patient leads me to believe that there are many more of his patients that have undergone an unnecessary, aggressive radical hysterectomy."
The goal and objective of this was that the government would stop him from ever, if you will, touching another human being again.
But today, Dr. Malvia still has a medical license. In April, the Department of Justice announced he would pay nearly $800,000 to resolve civil allegations of performing unnecessary surgeries. Malvia was banned from taking part in Medicaid and Medicare for 3 years, but not from practicing medicine. He admitted no wrongdoing.
It bothers me every single day. It's absolutely, completely a disregard for all the women who were hurt.
Both Dr. Malvia and his attorney declined to talk to us about the litany of allegations we just told you about. The only person who did was a hired spokesman for Malvia who released a statement. It reads in part, "Within his medical community, Dr. Malvia was widely regarded as a doctor of last resort, willing to take on the most difficult and challenging cases, including patients with severely compromising medical conditions. Given the complexity of these patients' medical conditions, it was impossible for Dr. Malvia to use a one-size-fits-all approach to their care. As Dr. Malvia was essentially entering uncharted waters, he carefully selected treatment regimens individualized for each patient." The spokesman stressed that Malvia settled the DOJ lawsuit without admitting any wrongdoing and maintains that his own medical experts would have testified that the surgeries and treatments he ordered were appropriate. Dr. Malvia adds he is now retired. You can read his full statement on our website at WXYZ.com.